What causes cerebral vasodilation to increase blood flow? It's C. High carbon dioxide. Which hormone initiates the HPA axis cascade? Correct answer is C. CRH. Which cell type produces pulmonary surfactant? Correct answer is B. Type 2 pneumocyte. Which hormone increases sodium reabsorption and potassium secretion in the nephron? Correct answer is C. Aldosterone. What key structural unit is found in both skeletal and cardiac muscle? It's B. Sarcomere. Which hormone stimulates inhibin secretion in the male? Correct answer is B. FSH. What is a renal effect of parathyroid hormone? Correct answer is C. Stimulates distal calcium reabsorption. What happens to sympathetic activity when blood pressure drops? Correct answer is C. Increases. What happens to sympathetic activity when blood pressure drops? Correct answer is C. Increases. Which transporter mediates active iodide uptake in thyroid hormone synthesis? Correct answer is B. NIS. Which lung capacity can be measured by spirometry? The answer is C. Vital capacity. What are GI slow waves best described as? Correct answer is D. Oscillating resting membrane potentials. What directly triggers calcium release from the sarcoplasmic reticulum in skeletal muscle? Correct answer is C. Ryanodine receptor. What compensatory change occurs in metabolic alkalosis? Correct answer is C. Hypoventilation. Which hormone is derived from pro-opiomelanocortin? Correct answer is C. ACTH. Which of the following causes a rightward shift in the oxygen hemoglobin curve? Correct answer is C. 2,3-BPG. Which hormone constricts the efferent arteriole to raise GFR? Correct answer is D. Angiotensin II. Which heart sound marks the end of systole? Correct answer is B. S2. Which hormone acts via GS protein and cyclic AMP? Correct answer is C. Glucagon. Which ion has the greatest influence in the resting membrane potential? The answer is B. Potassium. Which of the following is the primary buffer system in the blood? It's C. Bicarbonate buffer system. Which enzyme converts angiotensin I to angiotensin II? Correct answer is C. Angiotensin converting enzyme. Which condition is characterized by high ventilation perfusion ratio due to impaired perfusion? The answer is A. Pulmonary embolism. Which of the following best represents the equation for mean arterial pressure? The answer is B. Systolic blood pressure plus 2 times diastolic blood pressure, all divided by 3. According to Frank's Starling law, what increases stroke volume? The answer is C, increased preload. Which of the following is the gold standard for measuring GFR? It's C, inulin clearance. Which of the following factors shifts the oxygen hemoglobin dissociation curve to the right? Correct answer is C, increased CO2. Which of the following physiological factors directly increases cardiac output? It's B, increased preload. Which of the following physiological factors directly increases cardiac output? It's B, increased preload. Which ion is primarily responsible for the depolarization phase of an action potential in neurons? Correct answer is A, sodium. A 22-year-old gymnast reports blurred vision when performing flips and rapid head movements. Testing reveals impaired eye stabilization during head motion. Which reflex is responsible for this function? Correct answer is A, vestibulo-ocular reflex. A 22-year-old gymnast reports blurred vision when performing flips and rapid head movements. Testing reveals impaired eye stabilization during head motion. Which reflex is responsible for this function? Correct answer is A, vestibulo-ocular reflex. A 22-year-old gymnast reports blurred vision when performing flips and rapid head movements. Testing reveals impaired eye stabilization during head motion. Which reflex is responsible for this function? Correct answer is A, vestibulo-ocular reflex. A 40-year-old patient receiving rapid intravenous fluids experiences an increase in heart rate. The physician explains that increased venous return stretches the right atrium, activating a reflex that enhances sympathetic activity. Which reflex mediates this response? Correct answer is A, Bainbridge reflex. A swimmer submerges in cold water, triggering a reflex that slows heart rate and redirects blood to vital organs to conserve oxygen. Which reflex is responsible for this adaptation? Correct answer is A, diving reflex. A 55-year-old hypertensive patient stands up suddenly and experiences dizziness due to delayed blood pressure stabilization. Which reflex is responsible for detecting and correcting this drop? It's A, baroreceptor reflex. A 60-year-old male with COPD undergoes pulmonary function testing. During forced inspiration, excessive lung expansion triggers a reflex that inhibits further inhalation to prevent overinflation. Which reflex mediates this response? Correct answer is A, it's Herring-Brewer reflex. A 30-year-old endurance athlete training at high altitude reports reduced stamina. Arterial blood gas analysis shows a low pH and elevated CO2 levels. How does the Bohr effect facilitate oxygen delivery under these conditions? It's B, decreases hemoglobin oxygen affinity. A 30-year-old endurance athlete training at high altitude reports reduced stamina. Arterial blood gas analysis shows a low pH and elevated CO2 levels. How does the Bohr effect facilitate oxygen delivery under these conditions? It's B, decreases hemoglobin oxygen affinity. A 30-year-old endurance athlete training at high altitude reports reduced stamina. Arterial blood gas analysis shows a low pH and elevated CO2 levels. How does the Bohr effect facilitate oxygen delivery under these conditions? It's B, decreases hemoglobin oxygen affinity.